There we go. Well, hi everyone, and thank you for joining us for today's webinar, Rotary Ground Force Training. I'm Marianne Murphy, Vice President here at the Medical Fitness Association. I'd like to take a brief moment to introduce today's presenters. John Preston is the Director of Education at True Turn Pro. As a fitness educator, consultant, and industry advocate, John has been a fitness professional since 1993 with more than 30,000 hours of one-on-one client interaction throughout his career. As a former fitness director, John is passionate about helping the next generation of fitness pros thrive in their chosen fitness pathway. Also with us today is Carl Horn. Carl is the inventor and CEO of True Turn Inc. In 2016, Carl invented the True Turn Pro, the world's first non-invasive therapeutic device engineered to isolate and rotate the thoracic spine. This award-winning tool optimizes spine function and has three primary applications, which are injury prevention, rehabilitation, and performance enhancement. Now, today's webinar is sponsored by our industry partner, True Turn Pro, the world's first thoracic spine isolation and rotation device. True Turn Pro enhances trunk spinal rotation while improving range of motion, increasing strength and stability of the spine, and helping people unlock a better back and a better life. Now, if you have any questions as we move through today's webinar, please go ahead and type them in the chat or Q&A section of your toolbar, and all questions will be answered in the end in the order they were received. Okay, John and Carl, take it away.
You going first, John, like normal?
Well, you can go first on how True Turn came to be and what it does, and then we'll get into the slides.
Okay. All right. Hey, everyone. I'm Carl Horn, the inventor of the True Turn Pro thoracic spine isolation device. I embarked on developing the True Turn after a patient/client of mine walked into my office and asked if I could help him restore his ability to hit a golf ball. He was 70 years old at the time and a retired banker and loved to play golf. He was a single-digit handicap, and what that means is he was a really good golfer. And he had fusion surgery to his lumbar spine and asked if I could help him restore his rotation because about 6 months post-op, he was unable to rotate to any degree that would allow him to hit a golf ball. So I chose to help him. And long story short, I developed a configuration that we now call the True Turn Pro. And the reason why I call it a configuration is because I reached out and I grabbed a stick, a PVC pipe, and I started making rotary motions with the pipe, and quickly found out how I could cheat rotation so easily. Our arms are actually designed to rotate, right? We have internal and external rotation. We can glide horizontally, and this range of motion that we have in our shoulders allows us to cheat thoracic rotation. So I built a configuration called the True Turn that takes the arm motion out of the equation of rotation, anatomically speaking, and it isolates rotation. So the True Turn Pro is a non-invasive thoracic rotation device because it shuts down the ability of arm use, so to speak. So we call it locking the upper kinetic chain, and we'll get into that as we go.
Awesome. Thanks, Carl. So we're going to start here with what ground reaction force, and then we're going to take you on a little journey to what we call rotary ground force training. So ground reaction force, it refers to the force that's exerted by the ground on a body. So on the human body, in our case, with what we do as medical fitness pros or regular fitness pros like myself. So what that means is that without that ground reaction force, human movement is essentially impossible. And so if you're someplace where you can stand up, just stand up for a minute. We're not going to do a lot of movement. Actually, you're going to do very little movement. But if you can stand up, I want to have everyone stand up. So without flexing at the hip, without flexing at the knee, without plantar flexing at the ankle, I want everyone to attempt to jump as high as they possibly can. So I'm going to assume we normally do this session live. I'm going to assume no one was able to leave the ground. So without that energy that the muscles create when they contract and the subsequent movement that occurs at the joints, without that energy pushing into the ground, there is no ground reaction force, and therefore there is no movement. Now you might have done a ankle raise because you were able to plantar flex if you wanted, but probably weren't able to generate enough energy for the ground to react to allow you to leave the ground. So that's the importance of ground reaction force. And it's a fundamental concept in biomechanics, and it's crucial for understanding human movement because human movement can occur without a ground reaction force. So for medical fit pros, just a understanding of ground reaction force, what's going on between the interaction with the movement that's occurring in your patient's bodies and the interaction with the ground. If you look at that during each and every exercise, it can impact your program design and help you to improve performance, prevent injury, and just help with overall client success. So basically that little drill that we started with, it's an example of Newton's third law of motion, and that is for every action, there's an equal and opposite reaction. So if there is no action occurring in the body, you're not creating a ground reaction force, and therefore no movement occurs. So the magnitude of the force affects the ground reaction force. So if you contract your muscles with greater force, you're going to create a larger ground reaction force. And the direction that you apply the force, so if you want to move laterally, if you want to move forward or backwards, you have to apply that force at a different vector than just straight down into the ground, because that's just going to allow a sagittal plane movement if you go straight down into the ground. And where the location on the body where that force is exerted. And this is interesting because as we put this together, when you're thinking about most of the exercises we do in the gym, we're mostly thinking about our feet being in contact with the ground. I mean, obviously there's some things, if you're doing a plank, the forearms are in contact with the ground. If you're doing a push-up, your hands are in contact with the ground. But if you look at it through the lens of what is it like for a collegiate wrestler, like what's going on during a wrestling match, over the course of that match, their shoulders, their elbows, their head, their knees, every part of their body is going to be exerting some type of force into that wrestling mat. And that mat is going to send an equal and opposite reaction to what those wrestlers are doing. So I wouldn't even want to try to figure out all of the ground reaction forces that are occurring in wrestling. That would take the rest of my life, and I probably still wouldn't figure it out. But it's just, you can look at it through a broader lens than just what's going on with the feet. So things that influence ground reaction force, body mass. So heavier individuals exert a greater force. Something to take into consideration if you have a client who is, overweight, you realize that there's going to be a greater ground reaction force, and therefore there might be more a higher risk of some overuse injuries occurring or stress on the knee. So something to keep in mind. Also, just knowing that offensive and defensive linemen exert greater forces than wide receivers and defensive backs. So faster movements generate a larger ground reaction force. So sprinters generate more ground reaction force than marathon runners. And the direction of the movement influences the ground reaction force. If you go straight into the ground, you can generate a little bit more. Some of that's offset when you start getting into different angles and change of direction. Different shoes can affect ground reaction force, and more importantly, it's the impact absorption. When you think running, there's running shoes that are built the way they're built for a reason to minimize the impact of that ground reaction force on the joints and surfaces. Are you running on concrete? Are you running on a dirt trail? That can affect ground reaction forces and how it's distributed through the body as well. And then muscle activation patterns, so movement, skill development. Obviously we know that you can increase strength early on in a program without actually increasing hypertrophy. So you just get more efficient at moving through practice, and you can generate more force just through the muscles activating or engaging in the proper sequence. A golfer can hit a golf ball further without any additional increase in strength if they get their sequencing right in the golf swing. So it can help with optimizing exercise selection. Obviously, Olympic lifts require a great deal of ground reaction force. When you do a hang clean or a power clean or a snatch, at some point that bar needs to become weightless. And the only way that bar can become weightless is through the ground, the energy that's derived from the ground. And then that bar can float and the lifter can get underneath it. Things like strength training with squats and deadlifts, you got to push into the ground quite a bit through your feet to get out of the bottom and the hole of that lift. And in rehabilitation, you can look at how somebody might be compensating in their movement patterns and design exercises to correct those faulty movement patterns to get them through their injury and through their rehab and back to a higher level of performance or dailies of activity living as well. So foot placement is crucial for force application. If you think about if a golfer is standing in a super wide stance, they're not going to be able to generate as much energy from the ground and hit the ball as far, or if their feet are close together. And that's true for all exercises. Squat, your foot placement for squatting. If you take too small of a lunge, a step when you go into a lunge, that's going to affect ground reaction forces. So we can learn to apply force effectively through the ground and enhance performance. So we can identify areas to help with running mechanics, stride length, stride frequency, contact time. You got to have some advanced equipment to figure out that ground contact time. I believe Technogym treadmills have some of that information in them, but not all treadmills do. And then change of direction. So you want to understand how ground reaction force impacts acceleration and deceleration. And that's crucial for training, for sports. And I realize a lot of us don't work with high-level athletes. I myself really have never worked with really high-level athletes. However, with this new phenomenon with pickleball, we have a lot of people in our facilities who have probably hurt themselves at some point playing pickleball. They want to get back to it. So we've got this population that should be working with professionals to get their bodies ready to return to activity. We've got this population that's been sedentary for decades in many cases, and now they are running as fast as they possibly can to chase this little wiffle ball, and then they have to decelerate and change direction, and their bodies aren't prepared to do that because all of that is ground reaction force, like at its highest level in a completely detrained individual, and it's just a recipe for injury. And I'm sure as medical fitness pros, you're seeing a lot of these people. So understanding the impact of acceleration, deceleration, how we can help people reduce their risk of injury and get back to, recreational activities. So that brings us to preventing injury. So understanding ground reaction force, it can help with understanding or reducing the risk of things like shin splints or plantar fasciitis, as well as reducing the risk of more traumatic injuries like ACL tears. So when we talk about rotational movements in the transverse plane, we we put they're crucial for many athletic activities. Rotational movements are crucial for athletic activities. They're essential. You can't move without rotation. So we've got to optimize rotational movements to prepare people not only for activities of daily living, but performance as well. And then we understand how force is generated and transferred through these movements. So this energy from the ground has to be converted to rotational movement. In a lot of our joints, ankles, knees, you don't want a lot of rotation occurring there. The rotation starts with the hips and the spine and the shoulders. But the first couple of joints along the chain, they're not really generating rotational energy. So it has to transition from, the sagittal plane to the transverse plane as we move up the chain. We'll talk a little bit more about the kinetic chains coming up. So again, it says in many rotational movements, the ground establishes the foundation for the rotational force. I would change that now that I'm looking at to all rotational movements. We're not going to rotate without the ground. Shifting body weight towards the intended direction of the rotation creates a longer lever arm, allows for greater rotational force. And you see this in a lot of different sports. When a pitcher pitches, a baseball, they're taking a huge step towards the plate to generate more rotational force. When a quarterback throws a pass, they should step into it and move in the intended direction of the throw. They should step into it and generate more rotational force. Sometimes the defense prevents them from doing that, and usually good things don't happen when they don't get a chance to step into that throw. Proper foot placement. I mentioned this kind of with the golfers. If your feet are, if you don't take a big enough step forward as a pitcher, you minimize rotational power. If you don't, you stand too narrow when you're trying to defend somebody and playing basketball, or you're standing too narrow and you're trying to move laterally to get to a volleyball, all of that stuff affects ground reaction force and performance. And then linear movement contributes to overall rotational momentum. So if you think about like a javelin thrower, they run for a while. I don't know how long they get to run for, but they run for a while to generate more energy in the direction that they want to throw that javelin. And then lastly, angular movement, you can conserve energy, and they do that. You think of divers and or gymnasts or figure skaters when they do their quads. They always bring their arms in. When they bring their arms in, it allows them to rotate faster. But when you think of a figure skater, when they land, their arms are out wide again. So they had to decelerate their rotation by extending their limbs. So the kinetic chain, from the ground up, we're just talking about, we're going from the feet to the ankles, to the knees, to the hips, all the way up to the spines and out to the arms. And the way I like to, when you want to maximize rotation, the way I like to describe it, if you remember when we were little kids and we would play that game where you're holding each other's hands out in the playground, and the kid in the front is just walking and taking a couple little steps to their right or left, and the 15th kid in the back is running back and forth and finally gets whipped off the chain. So what's occurring, the kid in the front that's just walking, those are the feet. And the kid in the back that's getting thrown off the end of the chain, that's the end, that's the hands. So all that energy goes from link to link to link to link to maximize rotation at the end of the kinetic chain. However, if you want to get that maximum rotation at the end of the chain, you need to have a strong and stable core, because that's where the transition from the lower kinetic chain to the upper kinetic chain occurs. And the lower kinetic chain is comprised of feet, ankles, knees, hips. Upper kinetic chain, we've got spine, head, shoulders, elbows, arms, hands, fingers. So Carl briefly mentioned locking the upper kinetic chain. That is a term that Carl has coined. And what that means, and the way he described the True Term Pro, and you can see from that first picture, normally we do this one live and everyone has one in their hands. So those shoulder bars that go from the main bar of the true turn to where the pecs and the deltoids meet, that's what we call locking the upper kinetic chain. And what it does is it prevents glenohumeral horizontal flexion and extension from occurring. And once you take the arms out of the equation, all that's left to do is for your spine and the muscles that move your spine to take over and contribute to rotation. And it happens through our proprioceptors. It happens almost unconsciously. The body just knows the arms can't do their thing anymore. And the body just becomes more efficient at moving the spine and engaging the muscles that are required to move the spine. So that's what we mean by locking the upper kinetic chain. And then once the upper kinetic chain is locked, and we don't say close the upper kinetic chain, because you can still flex and extend at the shoulders while you're holding the true turn. So it's not closed. We call it locking. But once that ground reaction force is converted to energy, rotational energy, with a locked upper kinetic chain, that is by definition rotary ground force training. So now we're taking that energy from the ground and we are training rotational movements in the transverse plane in a more effective way than was ever possible before. So talking about ever before, traditional approaches to rotational exercise. Here's some things we've used in the past to develop rotational power: medicine balls, stability balls, resistance bands, cable machines, wooden dowels, or PVC pipes. If you guys use anything other than those listed, you can put them in the comments. We can talk about those at the end of the presentation. And so the benefits, once that upper kinetic chain is locked, it isolates and strengthens trunk rotation. It enhances core activation. I talked about that proprioceptively. The body just knows how to move the core better once the upper kinetic chain is locked. It enhances and strengthens overall hip function. And that's something Carl didn't mention early on when he talked about trying to restore rotation for his client. When he invented the true turn, it was just for the thoracic spine, but we've come up with all sorts of movements that help with hip function as well. And Carl will tell you that most back dysfunction is coming from the hip. So we can address not only spine function, but hip function with the True Turn Pro. It was a bonus, an added bonus of what you can do with the True Turn Pro. Increases body awareness and proprioception. I spoke briefly about that already. And it can stabilize the spine. So we can do some anti-rotation things to stabilize the spine. And the end result of that is you can optimize rotary force production. And that carries over to reducing low back pain, so that people get back to their daily activities, playing with their grandkids. And it has applications in sports performance as well. So here's the practical application. Normally what we do is we all get up and we all get to use the True Turn. You can see Carl's there with it, but I'm going to have Carl take over and discuss what's going on in each of the videos. So before he starts, this first exercise, you'll see this asymmetrical pull force. Hopefully you can see it on your screen. There is a resistance band attached to one end of the True Turn Pro. And that asymmetrical pull force is a way of applying anti-rotation resistance that's brand new compared to any other way to do it. And it's so effective. I wish you guys could all feel it, because once you feel it, then you're sold on this thing. But this device is awesome. But you'll see APF. We apply asymmetrical pull forces on almost any strengthening exercise for sure. We do use the True Turn without resistance bands for mobility, to increase mobility. But anytime we're trying to develop stability and or strength, we're applying most of the time an asymmetrical pull force. Occasionally there's a symmetrical pull force. So Carl, I'll let you take over.
Okay. Oh, we have the video. So the asymmetrical pull force is causing a cascading physiological effect throughout the body. you can imagine resistance on one side of your body and what that causes the opposite side or the trail side of the body to how it has to respond. This changes the kinesthetic feeling that you get from using a device like this. One thing that we should probably add to our bullets is how the kinesthetic and the proprioceptive feelings and responses that are being developed when you have a battle from right to left, upper and lower, or even contralaterally, right to left, top to bottom, in this sort of a sling type of effect. It is a game changer with regards to how we can rehabilitate and or increase functional movement and performance when you start to learn the world of asymmetrical pull force training. Do we want to go to the next slide, John?
Yes.
So this is going to be a demonstration of what we call the hip switch. And so with this movement, what you're seeing is ground force at its finest, because I have to create a stretch shortening cycle that takes place in order for me to move my lower kinetic chain independently of my upper kinetic chain. And then through that transverse motion with that asymmetrical pull force, I'm popping into almost a 90-degree hip change. You can see the rotation taking place in the lower body. And then we add the upper body with that. So it becomes extremely dynamic. It's much more difficult than what it looks.
Yeah, and this is a pretty advanced movement to introduce as our second exercise.
Yes.
But it lets you, it's an example of where you can go with it. This is not where you would start with a client. This is an exercise you might end up with a client or a patient.
All right, reverse lunge with and without rotation. So stepping back, I like to call them step back lunges, but this reverse lunge to high knee, this is extreme hip function as the asymmetrical pull force is constantly pushing my body to the right. So the left side of my body, my left hip going in and out of flexion and extension with the rotary pull force is causing trunk and core activation to a very serious level of stability that's taken place. So stabilizing the core and taking my left hip through extension and flexion with the asymmetrical pull force just changes, it completely and totally changes the lunge as you would with, bilateral dumbbells or a barbell. That asymmetrical pull force is a completely different monster. So hopefully you guys get a chance to feel what it's like to battle an asymmetrical pull force. Core activation. Yeah, so we call this a true term pro abdominal crunch. And when the upper kinetic chain is locked as it is, we talk about how doing exercises with some cheat codes. Some people are cheating many exercises without really being conscious that they're cheating a move. But when your upper kinetic chain is locked into a position, it becomes very difficult to cheat a move. And anatomically being corrected, it enhances the movement of an exercise. So that abdominal crunch there with the true turn, it feels like you're doing it with weight. The true turn only weighs 4 pounds, by the way, but that ab crunch is so isolated that it feels almost like you're crunching with 10, 15 pounds. Okay, the reverse crunch. This reverse crunch is just adding more moving parts, more gravity. I am pushing the true turn up through my coccyx balance there at the top, engaging the core. And if you can imagine doing this exercise with an asymmetrical pull force, which you probably are gonna see, I don't know what the next slide will be, but imagine doing an ab exercise with an asymmetrical pull force, what that would do to your core and your quality of your abdominal contraction.
Yeah, I don't think we didn't introduce the asymmetrical pull force on these sequences here.
Yeah. We should probably do that. So this is an alternating toe touch. We call it an alternating toe touch. As you can see, there's some rotation at the very top there. And again, you can't just rotate or you can't adduct your glenohumeral gliding of your arm. So I could just sit up and just reach over with my right hand to my left leg or my left hand to my right leg. But with the true turn, you have to turn throughout the core because it doesn't allow you to just reach with your arm. The whole entire core is locked in to a position, to a fixed position. All right, so yeah, this is, imagine being pulled to your right while marching. Your center of mass is changing from right foot to left foot, but you're constantly being pulled in one direction. So your core, your ground force management of your gravity and being able to balance your gravity is what the asymmetrical pull force is doing. All right, so again, you can imagine we're going through hip flexion and extension with an asymmetrical pull force. It changes the motion completely, fighting for your gravity, and then your brain learning how to manage the proprioceptive demands of maintaining your ability to balance. And so there's some physical therapy protocols with regards to fall prevention and moving patients in and out of different proprioceptive demanding drills for balance training. Is the asymmetrical pull force is a whole new realm of balance training and fall prevention. Internal hip rotation is what we're seeing here under an asymmetrical pull force. So you can imagine the concentric and eccentric contractions of the internal and external rotators in the opposite hip. So the asymmetrical pull force is on the right side of my body, therefore causing and demanding my left side of my body to be the generator and the reactor, both eccentrically and concentrically here. It's a great exercise for hip development. Again, an asymmetrical pull force. This walking drill is great for balance and proprioceptive training and core and hip stability. Imagine yourself walking on a balance beam with a 25-pound weight on one side of your body, and you having to manage that with every step you take. We can lock the upper kinetic chain, attach an asymmetrical pull force to it, and this simple exercise is very, very difficult to do with proper balance.
We've already seen this exercise, but we're looking through it through a different lens with the proprioception as
Yeah.
opposed to hip function.
Yep.
So yeah, it's the practical application. The first time we showed this was about how the hip function, but also that's going to cause a lot of body awareness, because the clients and patients have to stand on one foot with that asymmetrical pull force that's trying to rotate them one direction and also laterally flex their spine towards the anchor, and they have to find their body and figure out how to form this exercise, and it just helps with proprioception so much. Yeah, just the proprioceptive benefits of that are just amazing.
Yeah.
Same thing here. All right, Carl.
Okay. The back extension. Now, this is one of my favorite exercises. So again, when we talk about the many benefits of locking the upper kinetic chain, here we have a bilateral attachment of one resistance band, and I'm going through hip. Mainly, the contraction is in extension, but the eccentric part is pulling me forward into hip flexion and have an opportunity to increase range of motion in the hamstrings, lower back, and glutes. You can imagine it's like doing a front squat. And here's our front squat. And this is another favorite movement of mine to develop the posterior kinetic chain. The front squat with the arms being locked into a fixed position is a lot different than doing a front squat with dumbbells or barbell on your chest. If you can imagine the load of the lever being extended out from your center of mass increases the physical demand of the lift. It feels amazing to have the upper kinetic chain locked in such a way. That 8-pound band, that squat feels more like a 30-pound squat. Yeah. Again, posterior kinetic, anterior as well in the lower body, but the back function, the lower, the mid, the upper back function of the overhead squat with resistance, again with an 8-pound resistance band, is extremely difficult to do. Developing mobility in the hips and stability throughout the posterior kinetic chain. One of John's favorite stretches,
Yes.
lateral flexion. Doing lateral flexion with the true turn is very demanding alone without an asymmetrical pull force. Doing it with an asymmetrical pull force is it's just an unbelievable feeling, because you get an opportunity to lock your spine into position, really develop some mobility here, because your arms can't cheat the motion. You see most people when they do a lateral side bend, they're moving their arms along the plane, much more or equal to their spine movement. But here, the arms don't go anywhere. It's all spine. It's all lateral flexion in the spine. And this is under resistance. So, and we're moving outside of our center of gravity and mass. Yeah, we're good.
Okay. All right. So I want to mention before we start taking questions, one thing as fit pros, we move really well. We tend to demonstrate exercises well. But despite our awesome demonstration for our clients and our verbal explanation about what we want them to do, getting them to rotate properly is really difficult with all the tools we used to use. They instinctively find a way to cheat, and it's hard for us to have them rotate with proper form. And examples of that, if we have a medicine ball in their hand and we're in a sitting, like we're doing a sit-up, and we rotate from side to side, their spine will just stay square to the ceiling, and that ball is moving right to left. And the ball, it looks like rotation. It's what we call the illusion of rotation, and we can demonstrate it the right way. We can coach them up the right way, but they instinctively want to find the most efficient way to move that ball back and forth, and it's not through rotating their core. Same thing
using their arms.
Yeah, they're just using their arms. It's easier. So,
Yeah.
What the True Turn does for fitness professionals, medical fitness professionals, who I'm assuming you're dealing with some back issues, which a large percentage of the population has, is it makes our life easier. It helps us to get our clients and patients to move the right way, the way we want them to move, and therefore they get the results that they want. Because once they start doing the exercises properly and the movement patterns are the right way and the correct muscles are engaging, then the results follow. And that's what keeps us in business, is repeat customers and referrals. And we only get that by delivering the results. And the True Turn is it's going to help deliver results better than any other option out there. And I know this for sure. I've done it for 32 years, and I've seen a lot of stuff. And this is a vastly superior approach to exercises in the transverse plane. And it just makes our life easier to use it with our clients and our patients. It helps us get the results for our clients that they want.
Well, great. Thank you so much. Shall we go to questions?
Sure.
We do have one question. So this person is asking, with fusion surgery, there's
Yes.
generally a risk to the vertebrae above the fusion to need later fusion surgery because bending and twisting can't occur in the fused area, placing all of the movement at the vertebrae just above. So what do surgeons say whether this risk occurs with the True Turn Pro? Have you guys run into this?
Yeah, so my background, I've worked very closely with orthopedic surgeons, back surgeons, knee surgeons, and with regards to function and spine function, stabilized mobility is what we're all after. And especially in a spine that has internal fixation devices and components like a fused back does. And so the question is a great question, and it does shed light on how important the function has to become above the surgical site, which is the reason why I developed the True Turn Pro to really open up the dynamic function of the thoracic spine, which takes the torsion compression off of the lumbar spine, which is in this question, in this case, a surgical site that's been fused. So extremely important to increase mobility and stability in the vertebrae and the anatomical features above the surgical site.
Awesome. So on a similar note, regarding patients with osteoporosis or osteopenia, where physicians warn against spinal rotation.
Yeah.
Can you talk to that?
Yeah. So we know that in these cases, a brittle bone, the worst thing that we can do for a brittle bone is to leave it alone, to not place any pressure or creating any type of movement, flow of blood, muscle function to the multifidus muscles and the facet joints and all the anatomy and the anatomical features in and around the spine. The worst thing to do to a delicate spine like that is to avoid it, right? And by avoiding it, we're not protecting it. So you kind of have to think outside a little bit with regards to your philosophical approach to rehabilitation. And I was in the clinic in the mid '80s and throughout the '90s. And anytime you avoid, it says if you don't use it, you will lose it, even in the case of a brittle bone, right? Yeah, I won't harp on that anymore.
Yeah. I'll chime in a little bit on that because, you know, in this fitness field, there's a lot of theories, right?
Mhm.
There's a ton of theories, there's a ton of philosophies, there's a ton of approaches. Um, there's a lot of anecdotal theory out there.
Yeah.
There's one law I can think of, and it's called Wolff's Law. And that is when a muscle contracts and the subsequent tendon pulls on the bone, it leads to an increase in bone density. It's
Correct.
one of the few laws we have in this industry. Now, does that mean somebody who has osteoporosis in their spine should start off with doing the hip switch? No, not at all. But there are some
Good point.
isometric manual resistance exercises that you can activate the core and activate the muscles that pull on the spine without any rotation occurring at all. So you can start to develop that stability and start to get those tendons to pull on the facet joint to start trying to counteract the ongoing osteopenia or osteoporosis.
Yeah, we don't
There's
we don't we
very,
don't want
very
to give the
safe.
idea. We don't want to give the idea that some of the dynamic exercises that we presented with the true turn are what we would prescribe to a freshly post-op surgical patient or client, whether it be in the personal training setting or in a clinical setting. There's an appropriate protocol for everyone and every patient, and we have three main applications with the True Turn, as John mentioned much earlier in our presentation: rehabilitation and injury prevention and performance. So it depends on your situation and how to utilize the device. So multi-angle isometrics with manual resistance or with band resistance would be, a place to start someone who is just starting out, who is delicate. Maybe they're freshly post-op. Maybe they've been on the couch for 30 years and they just started playing pickleball. From couch to court, is what John likes to say, right? What's appropriate is it comes down to the skill level of the practitioner.
Yeah. And the thing is if you're avoiding rotation in the clinic, your client or your patient is just going to walk out that clinic and start rotating in daily life. So we. However, I'm open to talking to any medical professional about their opinion on why to avoid rotation. That'd be a wonderful discussion to have, because I'm always open to learning more information.
Yeah, I've never met a medical professional that is suggested we avoid rotation. But okay. Do we have any more questions?
Awesome. Actually, just lots of thank yous. Kirsten said this is great information. Natalie saying interesting info. Thanks so much. Terry saying thank you so much. She kind of feels like thoracic spine function's been neglected in the rehab industry and true cause of neck, shoulder, back, and hip function.
True.
So it was good
Yeah.
to see all of this together. If anybody else has any further questions, our experts are here right now. Go ahead and you can type it into the Q&A or the chat panel while we wait to see if there's other questions. I'll just say thank you so much, both of you, for sharing your knowledge and experience with us today. All attendees receive an email with an evaluation link for today's webinar that includes a spot to indicate which CEC you'd like to receive. So please be sure to complete the survey, and even if you don't need a CEC, we would love to get your feedback. Our next webinar will be held next Wednesday, September 17th at 3 p.m. Eastern. That one's entitled Changing the Landscape of Commercial Pool Operations with Timothy Pesh and David Jerkins of TMI Sustainable Aquatics. And I would be remiss if I didn't say we have our annual conference coming up on November 4th through the 7th, being held in San Diego this year. We co-locate our annual conference with Athletic Business, so you actually have access to all of the MFA sessions and events, as well as all of the Athletic Business sessions and their big expo and their events. We are currently running a September special. You can get a $75 discount during the month of September, but come October 1st, that is gone. So if you're planning to attend, register before September 30th. And I just want to let you know too that the folks from True Turn Pro will be at the annual conference, so it's a great opportunity to ask them more questions, maybe see their tool in actual use. So check out the events tab on the MFA website for more upcoming webinars and more information about the annual conference. I'd like to thank our webinar sponsor and MFA industry partner, True Turn Pro. You can learn more about them as you see the website is right there in front of you at trueturnpro.com. And you can, as I mentioned, you can see them at the annual conference. So I'm not seeing any further questions. Do you guys have anything you'd like to add in? Oh, we just got a thank you very much. But do you have anything you want to add in closing?
Yeah, I'd like to. So obviously we'd love to get the True Turn into all the facilities so that the clinicians can, provide a higher level of instruction. But also in alignment with just the device, we have a 4-hour continuing education course that we can travel and deliver in person, or there's an online option as well. And that's approved for 4 hours of CEC. So it's the education behind the device that's going to ensure that the practitioners and the fit pros use it properly and get the most out of it with their clients. So it's not just you get the True Turn and you're on your own. We're here to help educate you and make sure you're using it the right way. I just wanted to make sure that information was out there.
Very important.
Awesome. And they can find all that information on your website as well?
Yes, that information is all on the website. Yeah.
Awesome. Carl, did you want to say anything in closing?
No, this was a pleasure being with you guys today. We are launching a new website. So our website is fresh, new, newly updated, and should launch today, I believe.
Ooh,
Yeah. So,
that's always exciting.
yeah, it's exciting.
Yeah. Thank you. Yeah. Thank you guys for taking the time out of your day to be part of our day and learning more about the True Turn Pro. We know everyone's busy, and I appreciate you taking that time for sure.
Absolutely.
Awesome. Thank you both so much. And thanks everybody.
Thanks, Marianne.
Thank you.